thanks for joining us today on Real Estate Insiders TV. I'm Danny Poulos with the elite team at Blue Chip Lending, and our guest this morning is David Booth. He's a licensed insurance agent and the owner of Life Health Protection Group. And we're going to be covering a lot of the new changes in insurance, and especially for self-employed people like realtors and owners of real estate companies, to give them a little help navigating the insurance dilemmas and go over some of their options. So David, first take a minute, tell people what you do, how long you've been doing it, and then we'll get right into your questions.
Great. My name is David Booth. I live in Pompano Beach. I'm a licensed health insurance agent. I've been doing it about 4 years now, and I work with all the major insurers here in the state of Florida. And I'm also certified by the federal government for the marketplace to help individuals that need a subsidy. And I'm certified with CMS for individuals 65 and older that want to get a Medicare Advantage plan or a Medicare Supplement plan.
Okay, so let's get right into it. We're talking about a lot of self-employed people that don't have coverage from their employers, and they need to know the options out there and what direction they should take. So first, tell us the difference between someone just going on their own off to the marketplace and somebody working with a licensed agent. What are the advantages and disadvantages of both?
That's an excellent question, Danny. Thank you. The advantage of working with a licensed certified agent is it's a maze. Healthcare.gov, in the very first year that the website was set up, there were all sorts of difficulties. There were only a handful of companies, health insurance companies, that were on the site, and it was difficult to maneuver the site. You didn't know what you were buying. If you were looking for the cheapest, maybe the plan didn't include your doctor or the hospital that you might have preference for. If you get sick and you're in a plan that the hospital is not in the plan that you've bought, do you want to go to a hospital that you're not comfortable with? So a licensed certified agent is familiar with that. This year, when open enrollment started on October 15th, a whole set of new companies that haven't done business in Florida entered the marketplace. Companies that people really aren't that familiar with. Companies out of California, companies from other places. Again, it gets back to, is your doctor in that plan? Is the hospital, if you got sick, that you'd want to go to, are they in that plan? Not all health insurers have every doctor in South Florida.
Was that an improvement that at least there were more companies coming in, or did that just make things more confusing?
Well, both. It was an improvement because it drove costs down a little bit, you know, for those that are cost conscious, but it made it a little bit more confusing because now if you don't know, if you don't use a licensed certified agent and you're trying to maneuver that website, you're so confused with the price. What should I do? Where should I go? You know, if you're picking strictly on price, sometimes that's not the best decision.
Yeah, I think that people, not in their ignorance, but just not spending a lot of time having to shop for health insurance, just think, well, I need health insurance. And they think by having health insurance, you know, certain things are covered. But as you're explaining, if you go on the marketplace, every plan is different.
That's correct.
I personally wouldn't be able, I'd have to go get a health insurance license to be able to figure out, you know, how to shop and compare on the marketplace. So I think for the average person, forget about it being difficult. I think it's nonsense for them to think that they can find what's best for them on their own, acting as an insurance agent, trying to compare plans.
An experienced agent can guide you to the better companies and can ask you the key questions. An insurance agent acts like a consultant. He's going to ask what's important to you. You know, what hospital, if you got sick, would you like to go to? Who's your doctor? Do you have a preference on specialists? You know?
And answer me this then, if somebody's on the marketplace trying to figure this all out, they can still go buy whatever they find there and they think they're interested in. They can still go to a licensed agent and buy that plan through the agent and then hear what might be good or bad about the choice that they think they're making.
That's correct, and that's a wise decision. I've had friends, I have a friend that's a realtor in Broward, and he went on himself and got confused, didn't know what to pick. And then he tells me that he's 64 and a half and he's going to be 65 soon. And I said, why are you buying a plan for yourself? You're entitled to Medicare just in a few months.
Absolutely.
Just, you know, have a plan for your wife who's younger and your son.
Yeah, and without your input, he might have gone out and
he would have been paying a whole lot more and bought a plan for all three, not knowing that he's eligible for Medicare soon.
Right. Okay, so let's talk about the money now and the subsidies, because I think that's confusing to a lot of people too. They know that it may look like it's more expensive, but it looks like they've got some money coming back. They don't know how to get it, why they get it, how much they're going to get. So if they come to you, you're going to figure that out for them.
Correct.
So
you're talking about
how
subsidies from the government. You're eligible for subsidy if your income falls between 100% and 400% of the federal poverty level. 100% for a single individual is $11,670. At the high end, 400% is $46,680. That's for a single individual. For a couple, the minimum threshold for 100% of federal poverty level is $15,730. And at the top end, $62,920. If you fall between these numbers, you're eligible for a subsidy.
Okay, so hopefully we're talking about self-employed people and realtors, so hopefully not dealing with these bottom numbers of 11,000 or 15,000, right. But it's actually would be free health insurance for those people.
But if you have a family of four and you earn less than $95,400, you're eligible for a subsidy from the government.
That's what I'm talking about. So if they've been getting quotes on insurance and somebody's not talking to them about how much they're going to be eligible for, a family of four making $95,000 a year is going to be eligible for a subsidy from the government. So they're not going to pay.
Less than, right.
Right. So they're not going to pay that amount.
The full amount for the premium.
They think they're going to pay.
Correct.
So I mean, just another reason why you've got to get some professional advice. Let's look at it then now from the business owner side, because traditionally we're going to be talking about people that don't have insurance from their employer, and that's why they're looking at plans on the marketplace, or you're looking at plans for them on the marketplace. What can a business owner do, or what choices do they have to make about supplying insurance for their employees?
It's an excellent question. A small business owner like a realtor, I can introduce them to a third-party administrator. The individual, the real estate agent, can purchase their own plan through me on the marketplace, and the third-party administrator can help the realtor, the broker, assist that individual, either paying a portion of the premium or paying copays. A younger individual would have a lower premium and maybe a high deductible, but still may need care someday. So they're going to have a copay for a doctor.
Right.
They might have a copay for a hospital. A realtor wouldn't have to pay the whole premium. With developing a relationship with a third-party administrator, they can assist them, and the realtor can help with copays, and it can help in ways, maybe even pay a portion of the premium without paying the whole premium.
So this third-party administrator, I'm not clear on that. They work with the business owner in how they may be able to offer health insurance benefits in some form or another.
They assist the owner in an administrative sense, and they make it so that everything they do is legit, so that the owner, the real estate owner, can get a tax write-off for whatever he or she does to assist the real estate agent.
Right, so if you've got a real estate company and one of the benefits or tools you want for recruiting people may be that you have health insurance benefits. So one of these third-party administrators could sit with the business owner and show them how to put together a plan so they could offer some type of health benefits to the agents?
Exactly, yes. You know, the agent, the real estate agent can still come to me and I can assist them with getting a health insurance plan, possibly through the marketplace.
Right.
And then the third-party administrator can help the broker with copays, deductibles, maybe paying a part of the premium,
right,
and still get a tax write-off without paying the full premium or absorbing the full cost of, say, a deductible.
Wow. I mean, that's something, if you're a business owner and you're not offering a health insurance plan, it wouldn't make sense not to explore. What about things like dental and vision? Is that all covered in these plans on the marketplace too?
Another excellent question. If you're married and have children, and you buy a plan on the marketplace, they require pediatric dental. So if you have children and I assist you with a plan on the marketplace, they're going to give you dental. As an adult, someone 30 or older, they don't give dental on the plan. You can buy it as an adjunct or as an add-on to the plan, and you're not even required to buy it with the primary company. Right. I can assist you with companies that specialize in just dental insurance.
Listen, if you didn't get all that, it's no problem. That's why you can't go on there and shop on your own and try to figure this out. You've got to have somebody navigate all that for you. Another thing, before we run out of time, is the difference between HMO and PPOs. That's something that people have to understand.
Yeah, it really is, because an HMO stands for Health Maintenance Organization. All HMOs are in a given geographic area. In most cases, it's the county you live in. In an HMO, you have a primary care physician, and using a sports analogy, the primary care physician acts as the quarterback. He or she makes all the decisions about your care. He writes a referral to a specialist, and in an HMO, you have to go to the specialist that he writes the referral for. What's the benefit of an HMO? HMOs contain your costs. If you don't travel much for business or pleasure outside of the county you live in, an HMO is ideal. And if you don't care about the specialist, PPO. PPO stands for Preferred Provider Organization. The country is a preferred provider organization. As long as you go to an in-network doctor, using that same sports analogy, you become the quarterback. You still have a primary care physician, but you make all the decisions about your care. You go to see the specialist you want. If you want to see a dermatologist in Tampa, as long as he or she's in network, you're okay. The insurance company's not going to pay your travel expenses, but you can go to a specialist anywhere. For the snowbirds, PPO would be an ideal plan for them. They're down here during season. If they go back up to New York or New Jersey or somewhere like that, PPO, as long as they go to
So what you're saying is one isn't better than the other, but one is right for one person and the other is right for another person. And if you think you can figure that out on the internet, trying to train yourself to be an insurance agent, I think you're probably wrong. And this is where David comes in. So on that note, David, tell everybody how they can reach you for any health insurance related questions, how to navigate the marketplace, all these questions we talked about. How do they reach out to you?
My toll-free number is 855-752-1400. My cell phone is 954-695-7575. My website's lifehealthprotectiongroup.com. My email address is david@lifehealthprotectiongroup.com.
Don't try to do this without a professional. David, thanks so much for coming in today.
Thanks, Danny.
Unbelievable information.
Yeah, great. Thank you.